Hello viewers, today we are going to talk about infratemporal fossa and pterygopalatine fossa. The arrow on your screen here indicates the temporal fossa, not the infratemporal fossa, and we will move towards infratemporal fossa. The infratemporal fossa lies inferior to the zygomatic arch as indicated by the arrow here, and it lies deep to the mandibular ramus as indicated by the dotted arrow here. So this is the area of the infratemporal fossa. Now we are looking at a picture of the base of the skull. The area shaded in green indicates the area of the infratemporal fossa. Now we will talk about the boundaries and contents of the infratemporal fossa. Here we can see an arrow pointing at the zygomatic arch. Zygomatic arch is the lateral boundary of the infratemporal fossa. In fact, infratemporal fossa lies inferior and deep to the zygomatic arch. Anterior to the infratemporal fossa is the maxilla, as you can see with the arrow on your screen. Medial to the infratemporal fossa, the arrow here shows the pterygoid part of the sphenoid bone. And finally, posterior to the infratemporal fossa is the mastoid part of temporal bone. So the four boundaries of the infratemporal fossa: laterally zygomatic arch, anteriorly maxilla, medially pterygoid part of sphenoid bone, and posteriorly mastoid part of temporal bone. Now let's talk about the contents of infratemporal fossa. The arrow in this picture points at foramen ovale, and as we all know, foramen ovale allows the passage of the male structures, that is mandibular branch of trigeminal nerve, accessory meningeal artery, lesser superficial petrosal nerve, and emissary vein. Here the arrow points at foramen spinosum. Foramen spinosum allows the passage of the following structures through it: middle meningeal artery, middle meningeal vein, and meningeal branch of mandibular division of trigeminal nerve. Next up, this arrow points at the infraorbital fissure or infraorbital foramen, which allows the passage of infraorbital nerve, infraorbital vein, infraorbital artery, inferior ophthalmic vein, and zygomatic nerve through it. Now this arrow points at petrotympanic fissure, which is also known as Glaserian fissure. The most important structure passing through petrotympanic fissure is the chorda tympani branch of facial nerve. Along with chorda tympani nerve, anterior ligament of malleus and anterior tympanic artery also passes through petrotympanic fissure. Now this arrow points at a depression in the temporal bone. This depressed area is the area of the mandibular fossa. This is called the mandibular fossa. This participates in the temporomandibular joint. We will talk about the temporomandibular joint a bit later in this video. Now let's talk about the muscles of mastication. There are four muscles of mastication, and all four muscles of mastication are innervated by the mandibular branch of trigeminal nerve. However, they have different actions and different attachments. This muscle that you see on your screen here is the masseter muscle. It is arising from the zygomatic arch and attached to the mandibular ramus. The function of the masseter muscle is elevation of the mandible with power during mastication. Next up, we have the temporalis muscle. This is attached to the temporal fossa, and it passes deep to the zygomatic arch and attaches to the coronoid process of mandible. Temporalis muscle also has the same action, that is elevation of the mandible with power during mastication, and as previously stated, temporalis muscle, being a muscle of mastication, is innervated by the mandibular branch of trigeminal nerve. This muscle here is the medial pterygoid muscle. This is also a muscle of mastication. This is also innervated by the mandibular branch of trigeminal nerve. Medial pterygoid muscle is attached to the inner aspect of the mandibular ramus and to the pterygoid plate of sphenoid bone. Medial pterygoid muscle helps in side-to-side movement of the mandible during mastication. This is the lateral pterygoid muscle. This is also a muscle of mastication. Lateral pterygoid muscle also innervated by the mandibular branch of trigeminal nerve. Lateral pterygoid muscle is the only muscle of mastication which helps in depression of the mandible. That is the only muscle of mastication which helps in opening the mouth. Lateral pterygoid muscle also moves the mandibular ramus anteriorly and inferiorly. So lateral pterygoid muscle attached to the condylar process of mandible and the pterygoid plate of sphenoid bone. This is the course of the chorotympanic nerve, which is a branch of the facial nerve. Once it exits the petrotympanic fissure, it hitchhikes over the lingual nerve and provides secretomotor supply to the sublingual and submandibular salivary glands. Lingual nerve along with the inferior alveolar nerve are branches of the mandibular division of trigeminal nerve. Inferior alveolar nerve continues to the mental foramen and exits the mental foramen as the mental nerve. Finally, let's talk about the temporomandibular joint. As you can see here, this is the mandibular condyle, and that's the mandibular fossa on top. Between the mandibular condyle and the mandibular fossa is the articular disc, which is the fibrocartilage. This is what makes the temporomandibular joint a synovial joint. So this was a brief overview on the infratemporal fossa. Let's now move on to the pterygopalatine fossa. So now let's talk about the pterygopalatine fossa. If we take the skull and we cut it from the dotted line shown in the picture to your right, the blue line that is in the middle of the zygomatic arch, and we look at it from above, that is the superior view, we get to see two cavities or two fossae. The bigger fossa more laterally is the infratemporal fossa, which is connected to the smaller fossa, pterygopalatine fossa, through the pterygomaxillary fissure. The pterygopalatine fossa in turn has a small foramen on its medial side called the sphenopalatine foramen, which connects the pterygopalatine fossa to the nasal cavity. Now, as you see here, this area shaded in blue is the infratemporal fossa, which we have talked about previously. This area shaded in green is the pterygomaxillary fissure, which is basically the path or the door connecting the infratemporal fossa to the pterygopalatine fossa. This part shaded in yellow is the pterygopalatine fossa, and the red foramen on the medial aspect of the pterygopalatine fossa is the sphenopalatine foramen, and sphenopalatine foramen connects pterygopalatine fossa to the nasal cavity. So that's the arrow pointing at the sphenopalatine foramen. Now, often students complain that it is very easy to explain a part of the anatomy with fancy models and videos, but often answers that can be written in the exams are not discussed. So this is my attempt at telling you an answer that hopefully you can write in your exam. So if you can draw a diagram like this largely shows the pterygopalatine fossa. If you could make a mold out of it, this is what it is. Pterygopalatine fossa is basically an inverted pyramid shaped space. It lies medial or deep to the infratemporal fossa. Pterygoid, it lies between three bones: pterygoid process of sphenoid bone, palatine bone, and maxilla. Now, the important thing about pterygopalatine fossa is that it is connected to different parts of the body through 8 different foramina. Now, this is the pterygopalatine fossa if it's magnified and seen in the context of the lateral view of the skull. And here I have drawn a picture which you can easily draw in your answer if you get this question, and you have to label 8 foramina. If you remember these 8 foramina, what these foramina connect the pterygopalatine fossa to, and what are the structures which pass through each of these foramen, then I believe that is an adequate answer for pterygopalatine fossa if the anatomy of pterygopalatine fossa is asked in the exam. So let's start with foramen rotundum. Foramen rotundum connects pterygopalatine fossa to the middle cranial fossa, and only one important structure goes through the foramen rotundum, that is the maxillary division of the trigeminal nerve. Next up, we have the pharyngeal canal. We are going from top left downwards. We are going in the anti-clockwise direction. So starting with foramen rotundum, next we have pharyngeal canal. Pharyngeal canal connects pterygopalatine fossa to the nasopharynx, and the structures passing through the pharyngeal canal are the pharyngeal nerve and the pharyngeal branches of maxillary artery. Just below pharyngeal canal is the pterygoid canal, also known as Vidian canal. Pterygoid canal connects pterygopalatine fossa again to the middle cranial fossa, and the structures passing through pterygoid canal are very easy to remember: nerve, vein, and artery of pterygoid canal, or Vidian artery, Vidian vein, and Vidian nerve. Now, Vidian nerve is formed by the union of parasympathetic and sympathetic. Parasympathetic part of Vidian nerve is the greater superficial petrosal nerve, which is a branch of 7th cranial nerve, and the sympathetic part of Vidian nerve is the deep petrosal nerve, which comes out of the carotid plexus of sympathetic nerves. Next up, we have the lesser palatine canal. Lesser palatine canal Through the lesser palatine canal, we have the lesser palatine nerve and vessels. Through the greater palatine canal, we have the greater palatine nerve and vessels. And the lesser palatine canal and greater palatine canal connect the pterygopalatine fossa to the oral cavity through the palate. Now, on the lateral aspect of the pterygopalatine fossa is the pterygomaxillary fissure. Pterygomaxillary fissure connects pterygopalatine fossa to the infratemporal fossa. Now, structures passing through pterygomaxillary fissure are the maxillary artery and posterior superior alveolar nerve. The medial aspect of the pterygopalatine fossa is the sphenopalatine foramen. Pterygopalatine fossa is connected to the nasal cavity through the sphenopalatine foramen, and through the sphenopalatine foramen we have the sphenopalatine artery and vein passing, as well as the posterior superior lateral nasal nerve and the nasopalatine nerve. The nasopalatine nerve gives out septal and lateral nasal branches. And at the very top right hand corner we have the projected part of the pterygopalatine fossa. This is the infraorbital groove. This is not a foramen, it is an infraorbital groove, and through the infraorbital groove passes the infraorbital nerve. So I believe this answer is adequate, but if you want to discuss the nerves and the arteries and especially the pterygopalatine ganglion, then we need to discuss the orientation of the nerves a little bit more in detail. So let's get into that. So as you can see here, the pterygopalatine fossa lies between the maxilla anteriorly and pterygoid process of sphenoid bone posteriorly, and deep to these two structures is the pterygopalatine fossa through the pterygomaxillary fissure, and in the medial aspect of the pterygopalatine fossa you can see the sphenopalatine foramen. Now if we were to look at the orientation of the nerves in the pterygopalatine fossa, this is what the nerves look like. The projected part in the middle near the area of the sphenopalatine foramen is the pterygopalatine ganglion, and as you can see, this red vessel is the internal carotid artery. Wrapped around it are the sympathetic fibers, and the branch coming out of the sympathetic plexus is the deep petrosal nerve, which joins with the greater superficial petrosal nerve, which is a branch of the facial nerve or seventh cranial nerve, which carries parasympathetic fibers. So parasympathetic fibers of the greater superficial petrosal nerve join with the sympathetic fibers of the deep petrosal nerve. They pass together through the pterygoid canal, becomes the nerve of pterygoid canal or Vidian nerve, and they reach the pterygopalatine ganglion. As you can see here, through the lesser palatine canal is lesser palatine nerve, and through the greater palatine canal is the greater palatine nerve. Now in the infraorbital groove, the maxillary division of the trigeminal nerve enters the pterygopalatine fossa through the foramen rotundum, and it continues as the infraorbital nerve in the infraorbital groove. From there it gives out three branches which forms the superior alveolar plexus of nerves. Now this is the superior alveolar plexus. Rightmost in this picture is the anterior superior alveolar nerve, middle one is the middle superior alveolar nerve, and the leftmost is the posterior superior alveolar nerve. Together they form the superior alveolar nerve plexus, responsible for providing sensation to the maxillary teeth. These need to be anesthetized by dentists. Again, this is shown in greater detail here with labeling, and again this is shown in a better manner. You can see that there is parasympathetic supply to the lacrimal gland at the top, and we have the alveolar plexus of nerve supplying the maxillary teeth. Lesser palatine nerve and greater palatine nerve are also labeled here, and here we can see the greater palatine nerve and the lesser palatine nerve through the greater palatine and lesser palatine canals in the palate. Now this is an interesting thing. If we introduce a straw through the foramen rotundum on the base of the skull, we can actually look at the course of the maxillary division of the trigeminal nerve. Now we can see the straw through the pterygomaxillary fissure, and here we have labeled it pterygomaxillary fissure, pterygopalatine fossa. Inside the straw, depicting the maxillary division of fifth cranial nerve, it goes into the infraorbital fissure, then inside the infraorbital groove, and this is the better view. We can see the foramen rotundum at the back. The maxillary division of trigeminal nerve enters the infraorbital fissure, then enters the infraorbital groove. If we could see through the bone of the floor of the orbit, we could see the infraorbital canal, and the infraorbital nerve exits the skull through the infraorbital foramen as the infraorbital nerve, which provides general sensation to that area of the face. So this is a very nice picture. Now let's move on to the arteries. Now arteries also can be drawn. This we have shown the orientation of the nerves in the pterygopalatine fossa. Now this is the orientation of the arteries, and the arteries, the most important artery that enters the pterygopalatine fossa is the maxillary artery, which is the terminal branch of the external carotid artery. Now all the arteries are labeled here. Through the sphenopalatine foramen is the sphenopalatine artery, through the pharyngeal canal is the pharyngeal artery, through the pterygoid canal is the artery of pterygoid canal. Maxillary artery enters through the pterygomaxillary fissure, and this descending artery here is the descending palatine artery, which divides into lesser palatine artery and greater palatine artery. And we have the superior alveolar plexus of arteries as well, anterior, middle and posterior, just like the superior alveolar plexus of nerves. So this was the description of the pterygopalatine fossa. I hope you liked this video. If you have any questions, please feel free to reach out in the comment section. Thank you so much for watching this video. Take care. Bye bye. And please don't forget to be awesome.